This is Chronicle on WCVB Channel 5.
They call him Dr. Jim.
How are you doing?
All right, walking.
The braces are working?
Yeah.
You can do it.
His patients homeless. His office wherever necessary.
There is nowhere he won't go and nothing he won't do.
His work, more than a career, it is a calling.
If you walk around, you'll see it's kind of joyful.
Dr. James O'Connell's Healthcare for the Homeless program. A story of healing, dignity, and hope. Street medicine. Next on Chronicle. On a chilly winter morning, Dr. Jim O'Connell takes to Boston Common to treat one of his countless homeless patients.
Hey, good morning. You okay?
Twice a week, for 30 years, he's walked these streets, delivering medical care to the city's most vulnerable lost souls.
It's ever challenging. The rewards are huge. Most of the people we take care of are exquisitely appreciative of the fact we're there. They don't have many people in their lives. And trying to understand what that experience of illness and suffering when you've lost everything is pretty profound and pretty moving. If you need to get that taken care of.
Homeless vet Bryant Draycott has a nagging foot injury and a bladder infection necessitating he wear a urine bag. Bryant's lived on the streets for years, and like so many homeless, he's come to rely on this humble physician they call Dr. Jim.
I've known that guy long enough to know my own family. He's better than a Boy Scout, for crying out loud. There is nowhere he won't go and nothing he won't do.
Seeing patients on the streets is one of the myriad services offered by a remarkable organization Dr. Jim O'Connell co-founded in 1985. What began as a pilot program to treat the indigent has become a national model. Each year, Boston Healthcare for the Homeless sees 12,000 men, women, and children living on the fringes.
You can imagine someone who's homeless, who lives in the shelter, who has an infection in their foot, or even a simple surgery, and they can't go back to the shelter and recuperate there. Or they're living on the street and they have diabetes that's out of control. They can't really manage their diabetes on the street. So they can come in here and get those acute medical issues under control.
At Albany Street and Mass Ave, Boston Healthcare for the Homeless has built a state-of-the-art medical facility in a building once housing Boston's morgue. Here they offer comprehensive services, from a dental clinic to substance abuse treatment, psychiatric counseling to acute respite care.
Often when I'm initially relating to folks what I do for a living, they, their response is, oh, that sounds really sad and it sounds like it's so hard. And I sort of respond as, I feel really lucky to work with an organization that is so robust and creative in the way that we're trying to deliver services.
We're underneath bridges and we've taken care of people in corridors and in doorways as well as in bathrooms. I love our model. I mean, we literally meet patients where they're at.
The heroin epidemic has strained the resources of the healthcare system. For Richard Guido, Boston Healthcare's Suboxone Clinic has been a lifeline.
I'm 9 years clean. Being 9 years clean, having a place to live, and having a foundation. What this clinic has done for me is giving me moral support, mental support, social support. Everything that I needed, it's in this clinic.
It's a hard addiction to get away from.
Rafael Garcia slept outside on heating grates for years as he battled a ferocious heroin habit and HIV.
It's just an epidemic, and it's a disease. I mean, you're getting high, and your priority is to get that stuff that you use, the heroin, whatever. You'll spend everything you have on it.
With the help of Boston Healthcare for the Homeless, Garcia finally got clean last year. And he just found out this very morning he's been approved for housing.
I'm finally on my way to live on my own, have my own sweet home like they call it. Just don't have to be on the street anymore. And it's all due to getting clean and getting Suboxone.
The challenge treating the homeless is they present with so many issues, it's hard to know what to tackle first. Trauma, abuse, psychosis, addiction.
People who experience homelessness, particularly people who are experiencing long periods of homelessness, chronic homelessness, look 20 or even 25 years older than they are. A lot of the diseases that we would expect to see in a 60-year-old, we're seeing in people who are in their 40s.
My good people used to take such good care of me.
Some days here feel like Sisyphus pushing a rock uphill. But progress is measured in small miracles. Just ask Joanne Guarino, who survived violent assaults on the streets and severe leg burns in an incident that brought her here, desperate for help.
So when they took me in, they probably saved my leg, saved my life. I think I forgot how to love myself. I think I forgot how to care about myself in every which way possible. And I think they taught me how to really love myself for the first time in like years.
Fighting for his patients and against homelessness.
How are you doing?
All right, walking.
The braces are working?
Yeah.
You can do it.
Spend time with Dr. Jim O'Connell on the streets and you'll meet a cast of characters right out of a Steinbeck novel. Remember Bryant Draycott? He chooses to live outside because he says the shelters are too overcrowded and dangerous.
I don't do this 4 walls and a roof thing. It's just not me. I was told about a couple of days ago that I have a chance of getting a room. I got one. I'm not going to use it to live in. I'll stay there maybe a couple of days out of the week, and mostly I'll use it for storage.
When your day's work is survival, basic health takes a back seat. One study found the average lifespan among Boston's homeless is just 47 years old. But Dr. Jim, often accompanied by a nurse and a psychiatrist, believes his team can make a real difference.
This population calls us to stretch ourselves to our own limits. You know, we learned how you're supposed to take care of diabetes in medical school and residency, but then when somebody's trying to take care of their diabetes when they can't control their diet and they can't do exercise and they can't even store their insulin, all of a sudden you realize that I'm now back at the beginning trying to learn how to go through a system. And that's something very sustaining about that.
At the urging of Boston Healthcare for the Homeless staff, Dr. O'Connell wrote a book detailing his 30 years dispensing street medicine. There's the story of 2 of his favorite patients, found frozen and near death with core body temperatures of just 74 degrees.
And this is when they both came to McInnis House after having sort of set the record for people with the coldest body temperatures who ended up with no neurological damage.
Photos of his homeless patients line O'Connell's office. There's the youngest professor ever to teach at Columbia University. He had a schizophrenic break and spent the rest of his life living on Boston's streets. Jim and the man shared a love of philosophy. O'Connell recalling a priceless response when he asked the brilliant former professor if he personally knew Jack Kerouac.
And he said, you know, looking at me kind of askance, said, yes, he was a dashing young man, he said, but a terribly shallow thinker.
I haven't had any of my other meds in a while.
What is O'Connell most proud of as Boston Healthcare for the Homeless celebrates its 30th anniversary? That during the winter of 2015, the worst winter ever, there were no deaths in Boston from hypothermia. That they've forged partnerships with Boston Medical Center and Mass General to treat the homeless. That they've built a full-time staff, nearly 300 doctors, nurses, and social workers who want to make this their life's work.
We have an extraordinary staff dedicated to taking care of this group, and they do it with a, you know, you'd think it would be kind of grim to do it, but if you walk around, you'll see it's kind of joyful. People are offbeat, everybody's, you know, working hard, but the drive to provide the best possible care for each homeless man, woman, and children we see is evident everywhere.
I don't know why my skin cracks so bad.
Yeah, it's all cracked. Let me see, turn it over.
What keeps Dr. Jim awake at night? The constant need to fundraise and society's often harsh attitudes towards the homeless.
People become numb, including ourselves, to the problem as you see it in front of you day after day after day. You know, and that's the way things are rather than in how things can be solved. So I worry a little bit that there is a compassion fatigue in most cities around the country now, and certainly to some degree in our own city, is that we've tried so many things and done so many wonderful things, yet the problem persists.
I just want to see that eye before you go away.
As for O'Connell's legion of fans, count Dr. Howard Koh, the former U.S. Assistant Secretary of Health, now a professor at Harvard School of Public Health. He and Jim trained side by side at Mass General.
Too often people look at the issues of the homeless and quickly conclude that there's no hope here. But why we respect Jim and his colleagues so much is in an area where most people said there was no hope, Jim said, we're going to try to create some new hope.
In the foreword to Dr. O'Connell's new book, Dr. Coe wrote, quote, Jim and his colleagues gently nudge us to re-examine the fundamental questions of human existence.
Each chapter is just absolutely unforgettable. It's so vivid, it's so rich. If you read these stories, what Jim is trying to tell us is that what brings us all together and binds us together as human beings is that we are all wounded and we're all vulnerable. And Jim makes that absolutely clear in the way he writes and the way he's lived his life.
I refuse to give up. I'm going to fight this to the end.
She's inspiring to all of us. She's what keeps us doing this work.
There are those who look at the homeless and wonder why it should fall on others to pick up the pieces. On a practical level, Boston Healthcare for the Homeless says it saves taxpayer dollars by dramatically reducing costly emergency room visits. And on a humane level, here they believe providing healing, dignity, and hope is what caring societies do.
We live in a state that really is just remarkable in providing resources for vulnerable men and women throughout the state. How wonderful for our patients, you know, because as we all know, health care is a right. And everybody deserves it.
To respond to an alarming rise of homeless families, Boston Healthcare for the Homeless created this unique outreach team. They deliver primary care to motels where families are shoehorned into tiny rooms. A recent success story, a pap smear detected cervical cancer in a mother who emigrated from the Congo 2 years ago. She's since been treated and is cancer-free.
Families that are homeless are really trying to take it day by day, so that family would not have access to any primary care or preventive care. So if we were not there, there would be no chance that she would have actually been diagnosed with cancer.
For those patients not sick enough to be in a hospital, but too fragile to be back on the street, there's McInnis House. It's the top 2 floors of this facility, a 104-bed unit providing round-the-clock care. Patient Tracy Smith says it's a very special place and wells up in tears when talking about her nurses and doctors.
I can't name them all, but I tell you, this is a wonderful place. If you really need a good place to be, that because you need help and you need love and support, the Barbara McInnis House is that. I gotta get a breath. Good morning, my dear.
Hi, how are you?
Tracy's story is heartbreaking. One of 11 brothers and sisters, she dreamed of being a chef, but life derailed early. Over the last few years, she waited too long to seek treatment for a mass on her ovaries, and it's metastasized into ovarian cancer.
She's inspiring to all of us. She's what keeps us doing this work. Through a series of events, I ended up homeless and has been on and off homeless for 25 years. Health was not her priority. She was dealing instead with safety on the street and where to sleep. And as a woman, you're particularly vulnerable to sexual and physical assault.
For the last 5 months, Tracy has been clean from using drugs. She's undergone chemotherapy and done meditation and Tai Chi to relax. But the harsh reality is doctors have told her she may only have 6 months to a year to live.
I'm not giving up. I refuse to give up. I'm going to fight this to the end. And when the end comes, it's thunder and lightning because I'm going in there very angry. Very angry. And then I'm going to cry to the Lord is, why did you do this? Why you take me so soon? I wrote this poem the night that I found out that I had ovarian cancer. Time can trick us all, especially when we fall in and out of traps, set to burn, get caught up in a yearn to turn grave mistakes along the path of life.
Through poetry she's written, Tracy has been reflecting a lot on her life, and she's praying often for the staff here.
The support here is they're all, oh, you look beautiful, you look beautiful. You know, even if you don't feel beautiful, they make you feel beautiful. They dance with you in the hallways, and, you know, if they don't got what you need, they're going to get it.
¿Cuánto tiempo tiene este tos?
Llevo como 2 o 3 semanas, empezó a sacar desde que me caí.
Down the hall, this homeless man has terminal liver cancer. He speaks no English, and save for a brother who may come from Puerto Rico, he is alone in the world. Sad, of course, but that is not at all how the folks at Boston Healthcare for the Homeless choose to see it.
And so very often some of our long-term patients, when they know that they're dying or that they have a terminal illness, they might ask if they can come and die with us because they want to die with people that know them. It's such a privilege to be able to care for people at the end of their life. That's really a pretty special part of the work that we do here.
Supporting sobriety with day programs for the homeless.
Sober, because if they get here at 8 o'clock in the morning and they don't leave again until 2 o'clock in the afternoon.
It's not surprising that in the first state to guarantee health care, Massachusetts leads the way in innovative services for the homeless. In its Dorchester Kit Clark Senior Center, Bay Cove Human Services runs a day program for homeless adults. Shelters make guests leave at sunrise, so having a place to go, particularly for older, more fragile men and women, is warmly welcomed.
I'm 73 years old and I live in a shelter. Okay, I'm homeless, but I feel safer here than out on the streets because things happen and I don't want them to happen to me.
It was nice when it opened up 7 days a week here because that gives people, when you get put out of shelter on Sunday, there's nowhere to go. So these people have a place to go.
Homeless shelters can be tense, crowded, and potentially violent, conditions that make it nearly impossible to get a restful sleep. But here you can find a hot meal and a calm place to regroup.
We wanted to be able to help folks with health care needs, with behavioral health challenges, to provide a hot meal, to provide a shower. Some people come in and they do their laundry. Some people come in and they're looking for a job, so we're helping them fill out an application.
Bay Cove's day program began as an experiment a year ago and now has 27 participants. Having structure during the day is allowing some who've been hardened by the streets to make changes that are difficult when your sole focus is survival.
Many people use coming here as a mechanism to stay sober because if they get here at 8 o'clock in the morning and they don't leave again until 2 o'clock in the afternoon, that's a 6-hour window when potentially they won't be using anything, and that's very helpful.
One thing everybody who is homeless seems to have in common is that they're broken in one way or another, you know, broken mentally, physically or spiritually.
Near North Station, Bay Cove runs treatment and support groups for homeless men and women who are working hard to overcome drug addictions.
I have a lot of empathy because I see how easy it is to become homeless. You know, if you have a job, you lose the job, you have no cushion, you can't pay your rent, you're evicted, you're homeless. And you have an addiction, and that is a very tough life.
He's semi-conscious over here. He wasn't when we got here.
4 people a day in Massachusetts die from opioid overdoses, so providing addiction treatment has never been more paramount. These 4 chronic drug users are doing very well in this methadone program, but each day, each hour can be a struggle.
It brings you down, like you get depressed over it. You know what I'm saying? You know, I didn't plan on being out here this winter. This is the first winter that I'm going to be out here, and that's not how it was supposed to go.
3 people in my family died through substance abuse. And, you know, so it's a real serious thing, and I know that there's a lot of people out there that are going through and went through the same similar things that I've gone through due to the disease of addiction. I just hope that we start seeing more Bay Coves spread up around the city instead of condos. Jail institutions and death, you know, by putting the toys away, meaning substance abuse, a lot of those get eradicated.
If there's one thing recovering addicts and caregivers alike stress to us, the importance of seeing drug addiction as a disease like cancer that needs funding to beat it. It may take some longer than others to get clean, but without help, they say, there is no hope.
When someone's finally ready to take the huge step of dealing with their addiction, we want to make
treatment available to them then, because we don't know if they can't get into treatment then, they're probably going to use again, and we don't know when they'll next be ready to seek a treatment option.
I was a 10-year hopeless drug addict where nothing worked. Thanks to the treatment center here at Bay Cove, I've been clean for a year, and I have no cravings, and hopefully I can move on with my life.